High cholesterol represents one of the major controllable risk factors for heart disease and strokes, which are two of the leading causes of death globally. It is estimated that 93 million adults in the United States have total cholesterol levels above the recommended range. It's concerning that high cholesterol often doesn't show obvious symptoms, which means many people may have elevated levels without realizing it. Therefore, it's crucial to recognize common signs that may indicate higher than ideal cholesterol levels. In today's video, I'll cover 8 signs and symptoms that may suggest high cholesterol levels in your body. I'll explain these symptoms, how they relate to high cholesterol, and when it's important to seek medical attention. Number 1. Chest pain. If a cholesterol plaque breaks loose in one of the arteries supplying blood to the heart, it can completely block blood flow and result in a heart attack. That's why feeling chest pain is a warning sign to check your cholesterol. Heart-related chest pain, known as angina, is often described as an uncomfortable sensation of pressure, tightness, fullness, or pain in the center of the chest. Sometimes this pain can radiate to the jaw, left arm, or upper back. High cholesterol increases the likelihood of plaque buildup and blood clot formation, making it important to investigate any recurrent or unexplained chest pain through proper medical evaluation. Number 2. Dizziness. Brief periods of feeling lightheaded, dizzy, or like everything is spinning around you can be harmless. However, repeated episodes of dizziness may be related to high cholesterol and reduced blood flow to the brain. Medical conditions such as vertigo or migraine can also trigger the sensation of dizziness. However, if there are neurological symptoms along with risk factors for artery problems, it's important to seek evaluation to check cholesterol levels. When cholesterol narrows the arteries that carry oxygen-rich blood to the brain, it prevents brain cells from receiving the necessary nutrients. Brief moments of dizziness or instability can indicate that the brain isn't receiving enough blood due to high cholesterol levels. Number 3. Rapid heartbeat. Having high cholesterol increases the pressure on your cardiovascular system. When cholesterol clogs the arteries around the heart responds by pumping harder and faster to circulate blood through the narrowed blood vessels. You may notice occasional palpitations or a rapid, fluttering heartbeat when cholesterol restricts blood flow to the heart. The medical term for this is arrhythmia. Although anxiety or caffeine can also cause a rapid heartbeat, it's your heart's way of signaling that something is wrong if it occurs repeatedly. A resting heart rate consistently above 100 beats per minute may be linked to high cholesterol. Number 4. Fat deposits in the skin. One of the most visible signs that your cholesterol may be high is the fatty deposits that develop under your skin, called xanthomas. These yellowish and irregular growths are most common on the eyelids, knees, elbows, and buttocks. Xanthomas form when cholesterol accumulates in the soft tissues under the skin at a faster rate than the body can eliminate it. They vary in size and can sometimes resemble warts. The presence of xanthomas strongly indicates dangerously high cholesterol levels that require treatment. Number 5. Numbness and tingling. Have you ever experienced sensations of numbness, tingling, or prickling in your hands, feet, or limbs? This is known as paresthesia and occurs when cholesterol plaques restrict blood flow in the peripheral nervous system. Poor circulation causes the nerves in the extremities to function improperly, sending strange sensations to the brain. It's common to feel numbness and tingling in the hands and feet, especially at night in bed or when sitting or standing for long periods without moving. These sensations can be an early sign of peripheral artery disease, a risk associated with high cholesterol due to restricted blood flow to the arms and legs. Number 6. Fatigue. Feeling constantly exhausted and lacking energy, even after periods of rest, can indicate that your body is not functioning at its best. When cholesterol plaques restrict blood flow, oxygen delivery throughout the body decreases. This results in less oxygen reaching the muscles and organs, which can cause weakness, sluggishness, and fatigue. Even light physical activities can leave you extremely tired. The sensation of generalized fatigue and persistent weakness is your body sending a signal that something is not right. There are several conditions that can cause fatigue, including anemia and thyroid problems. However, it's important to consider poor blood circulation and lack of oxygenation due to high cholesterol as possible factors. Number 7. Blurred vision. Experiencing sudden blurry vision, double vision, or vision loss are primarily indicative of eye problems. However, in certain cases, vision changes are associated with high cholesterol. This happens because cholesterol plaques can accumulate over time in the arteries supplying blood to the optic nerve and retina. This buildup damages nerve fibers and small blood vessels responsible for clear, focused vision. Vision changes due to cholesterol typically affect both eyes equally. An ophthalmologist should investigate high cholesterol and other possible causes, such as diabetes, glaucoma, and macular degeneration. Number 8. High blood pressure. There's a strong connection between high cholesterol levels and high blood pressure. When there's an excess of LDL cholesterol in the bloodstream, it can gradually accumulate on the inner walls of the arteries in the form of plaque deposits. This process is known as atherosclerosis. These plaques narrow the arteries, making it difficult for blood to flow. As a result, the heart needs to work harder to pump blood through the blocked arteries, leading to an increase in blood pressure.